Good morning. Welcome to another edition of Health Department Roundtable. I'm your host and member of the Board of Health, Chris Schultz, and with me today is our public health nurse, Lindsay Wright. Good morning,
Good
Lindsay.
morning. Hi, good morning. How are you?
Good. How are you?
Good. Busy week.
Yes. Yeah, there's a lot to cover today. So we'll start with an update on our COVID numbers, and then I'll just kind of hand it over to you to hit on our various updates.
Sounds good. So we have 16 active cases in town. That is the lowest that we have seen it since October. So very exciting. Yesterday we were actually down even a fewer. I added some more cases this morning. We had a few come through. We have 10 residents quarantined. So keep doing what everyone's doing, staying home when we're sick. That is going to be the biggest thing. We're still seeing people, oh, well, I wasn't sure. I didn't feel that bad. Please stay home. It's the simplest way for us to get out of this and to stop the virus from having anywhere to jump to is if we just stay home. And so in town, we've had 1,997 total cases. And then if we take out our active, we've had 1,981 have been removed from tracking.
Wow.
So definitely moving in the right direction.
Just offhand, and I know we updated on the dashboard. Do you know offhand our percentage of vaccinated at this point?
I don't. I didn't take a look at it. It updates, the state updates Thursday nights. And then we had a second dose clinic yesterday. And so I was running around. Angela, Marty, and I were kind of preoccupied with we had a handful of second doses. So I can, if the website isn't updated, it will be first thing Monday morning.
Okay. And I'll remind our listeners that if you go to the abingtonma.gov and click on the health department update along the top, that'll give you the most recent numbers and also has the dashboard for vaccinations.
A quick vaccine update. I do want to thank a sincere thank you to the Abington Fire Department. I know we constantly are thanking each other for everything we're doing for each other, but we couldn't do what we do without them. The schools as well, and the school nurses, they know how much we appreciate them. But Abington Fire and the Health Department just completed our homebound waiting list of residents looking for homebound vaccines. So on Tuesday, we went out and did just about, I think it was 35 on Tuesday. And that completed, we did 65 homebound residents and caregivers.
Wow.
And so we couldn't do it without their help.
That's pretty awesome.
Yeah. So some got Johnson & Johnson. And there was a handful that did get Moderna. So we will be back out June 1st for those residents who got Moderna to give them their second doses. And by mid-June, all of our homebound residents will be fully vaccinated, which is awesome.
Excellent.
And then Bridgewater State, we have partnered with. I believe Marty brought this up at the Board of Health meeting, that the site was getting vaccine into open. They had kind of a soft opening over the end of last week, and they will be open. So we are helping them out, kind of working as a health department liaison to local towns because some of their vaccine can be allocated to local communities, which is great news for us. It means we can bring vaccine back into Abington. So with that, we will be able to get some Pfizer doses. So if, we're going to have a clinic at the high school for kids 16 and older. We're expecting the Pfizer EUA to come through for adolescents 12 and older in the coming week, which means as long as the school is still okay with us hanging around with them, they will hopefully be able to do a clinic for 12 and older at school. Same thing, no disruption, just need parental consent, and we'll come and we'll give them their shots and they'll go back to class and try to do this as conveniently as possible.
Need no driving halfway across the state for a vaccination.
No, we want to do it in their backyard and we did it with the seniors. They're most comfortable at the senior center. They know it really well. Our students know the middle school and the high school really well. So let's pull them out of class for 10 minutes, 15 minutes, give them their vaccine, keep an eye on them, and let them go back to class like nothing happened.
Awesome.
So again, and anything we do school-wise is voluntary. It is not a mandatory vaccine. It is not required that any student participate. It is just something that we think that if we can offer, it's a convenient thing. Parents work, kids can't always get to the pediatrician. My kids go to the pediatrician, it's 45 minutes away. So if we could offer it in school, it's just a convenience thing. So no pressure.
And I presume if that, when that happens, notices will go out to people through the school system.
Yep. If it hasn't, for the 16 and older clinic, if it hasn't already gone out, it will be going out by Monday. We were trying to lock down a date. MCAS is this week, so scheduling of a clinic, we were trying to make it so that it was as seamless and the least interruptive as possible.
Awesome.
So we nailed down a date yesterday, mid-afternoon. And so that is, the plan is for Wednesday for the high school kids. And you should be receiving communication from Peter and or Felicia coming shortly if it hasn't already gone out.
Excellent. And that's a reminder for everybody how hard our health department and our school system works. Late Friday afternoon is after town hall is closed. You're still working. One other thing that I'd like to touch on, because this actually I saw the email go out through Constant Contact, is the Red Cross training initiative.
Yeah.
That you're doing.
It's so exciting.
You have your first class booked and full already, right?
Overnight.
Nice.
Yep. So it's kind of cool. We used a Google form, so we can see when people are signing up, and we sent the Constant Contact out, and within 3 minutes, the first student was signed up. So Marty and I were doing a little dance in the office. It's really exciting for us to be able to offer something other than COVID community support. Not that we don't love it, but it is very exciting for us to be able to start expanding the services that the health department can offer. Both Marty and I have extensive backgrounds in medicine and teaching, and so this is right up both of our alleys, and we're real excited for it.
Nice. So this the one that was just booked was babysitting.
Babysitting, yep. So that one, June 21st and 22nd, that one is full. So we sent out a second Constant Contact saying, if there's interest, we'll host one in July. And I believe there's already 11 or 12 students interested in a July class. So that one will be hosted as well. We just haven't, again, we were running around yesterday doing clinics. And so I have to get that registration for that set up. And it will be the individuals who had emailed me regarding interest. We'll get the link and then we'll open it up to everyone else.
Awesome.
We'll be scheduling CPR. We can teach, hands-only community-based CPR all the way through basic life support for healthcare workers. We are both now certified to teach wilderness first aid and emergency medicine. So I think Marty had talked to you about that, Boy Scout troops, Girl Scout troops, any group interested, if there's a hiking group in town, we're all about providing whatever education we can. And then bloodborne pathogen is the other one that we are able to teach now. And so for our tattoo parlors in town, that means they don't have to go searching for their courses yearly. Marty and I can offer those.
Oh, that's awesome.
So yeah, big stuff.
Yeah.
Big non-COVID stuff.
It's nice to have something else to focus on besides this darn virus.
Yeah. So virus related, graduation is coming. Graduation's, I think, just about 3.5 weeks away. Just as a reminder, if you're going to have parties, keep an eye on the limits of gatherings and just be mindful. We know that it spreads in social settings. People let their guard down. People have their masks down. Just be mindful. We're not saying don't do it. Just be smart when you do it.
Yeah, no more spikes. And I would also like to remind people, because I've gotten this, I've seen this question on the town pages on Facebook, as far as the mask mandate. The governor did relax it for when you're outdoors,
Yes.
socially distanced, but both in the state and in the town of Abington specifically, there are still mandates in place for wearing masks indoors.
Indoors. I've been to the store a few times in Abington and have noticed a few more individuals whether it's just we forget but just pointing to my face and like, oh, geez.
Yeah. And
So
I saw an interesting conversation that I'll highlight here. Somebody who was adamant about not wearing a mask when they go to the store. If a place like Stop and Shop, employees are not allowed to enforce the mask mandate, the managers have to do it. And if you've ever met a store manager, they're wonderful people that have to deal with a lot of problems. The last thing they want to do is come and ask you to leave the store.
Right.
So while you think might be exercising your liberties, you're also making somebody else's day really bad. So please just wear a mask in the store.
Yep.
That's all we ask.
And if you need some, I have plenty of extra. I'm happy to provide them.
Yes, always call our health department if you have any needs or questions.
Absolutely.
Lindsay, thank you very much for joining me this morning for our updates.
Thank you for having me.
Anything else you want to get across, or?
Just the reminders of staying home. You know what? I have one more thing. When contact tracing, it is a zero judgment. I'm asking a bazillion questions, and I know when I'm on the phone, I'm sure everyone on the other end is rolling their eyes. Like, what is she doing? Like, oh my God, I have to tell her I was with 15 people. And at the end of the day, my job is to keep the community safe. And the only way I can do that with Marty and the health department and the fire department and all that is with the community's support and their help. And so honesty and contact tracing is the biggest thing. If you were with 15 people, just tell me. It's more phone calls for me, but I'd rather make them and pull those people out of the stream of, going to school or going to sports or work and stop more people from being exposed. And I'm not going to give details, but we had a case who was younger, who had been around a group of individuals. And this case was so honest and so helpful. And it was just a breath of fresh air. And I actually emailed her to thank her for the honesty and the help. Because I was with these people. I'm sorry. I said, there's no sorry needed. You weren't symptomatic. It was a subsequent, just fell into the infectious period. But it was pretty cool that this individual was so forthcoming with the information. Mm-hmm. And just understood that we just needed to get these individuals quarantined to keep the community safe. So it is so helpful when that is the response, not, oh, I didn't see anyone, but Facebook says otherwise.
Your contact tracing does not communicate with Santa's naughty list. So people.
No, it stops right at my desk. It's a lot of phone calls, but it stops right at my desk, and it really is a zero judgment game. I just want to make sure that the people who need the information have it and have the correct information. We don't want anyone out of their general world, their usual routine, any longer than we have to. So, a lot of people still think it's a full 14 days, and we can get them out in 7 if they test. And so these are things that talking to us, and we actually have the ability to get some resources if it's hard for them to quarantine.
I had read too, and I haven't seen a lot of people talking about this, but no, I'm sure there's people out there that aren't as concerned with infecting others because they're in the the asymptomatic age range. The more the virus gets around, the more chances there are for variations and mutations.
Yep.
So if you don't want to see another worse variation coming along the lines, is stop it in its track.
Yes. Yep. And that's the point of quarantining, is trying to stop it.
Stop the spread.
Yes.
All right. Well, thank you again, Lindsay.
Well, thank you.
Hope you enjoy your Saturday. And
you as well.
Everybody else, always remember, if you have any questions or anything you'd like to see us specifically highlight on our roundtable, please either contact the health department or the Abington Board of Health Facebook page. We're here for you. So stay safe, wear your masks, and we'll see you again.